All right. Good afternoon. My name is Lori Zabata, and I'm a proud JWU alumna and the Director of Alumni Relations at Johnson & Wales University. Thank you for joining us for today's session, Fact versus Fiction, JWU alumni protecting public health and preserving the restaurant experience. We are excited to bring this program to you and look forward to this interesting discussion related to the experiences of a few of our alumni. We're keeping our fingers crossed as severe weather is moving through much of the East Coast today, and we hope that our technology fully cooperates. Before we get started, I'd like to review a few housekeeping items. If you have a question for the panelists, please add it to the Q&A section at the bottom of your screen. These questions will be asked of the panel at the conclusion of the program, and we'll get to as many as time allows. The chat feature can be used to message other attendees privately or publicly. This section is located also at the bottom of your screen. I'd like to thank the Alumni Relations team for their help behind the scenes of today's session, especially Liza Gentile, Assistant Director of Alumni Relations and proud JWU alumna herself, for her work to bring this program to us. Thank you. I'd like to introduce today's moderator, Bridget Sweet, Executive Director of Food Safety at Johnson & Wales University. Bridget is based in Providence, Rhode Island, but has responsibilities for all 4 of JWU's campuses. She's an active participant in Rhode Island's developing food strategy and an advocate for reliable and relevant food safety education and practices. Bridget is also an active member of the Conference for Food Protection, where she serves on a variety of work groups and council too. Bridget has a broad background in food safety that includes regulatory, industry, and higher education experience. She has served as a food inspector for the city of Taunton, Mass., environmental public health officer at Harvard University, public health administrator for the town of Sharon, Massachusetts, and as global food safety specialist for Whole Foods Northeast and North Atlantic regions. She's currently pursuing a doctorate in law and policy at Northeastern University and holds a master's degree in food safety from Michigan State University and a bachelor's degree in marine safety and environmental protection from the Massachusetts Maritime Academy. She's a resident of Franklin, Massachusetts, where she serves as the chair of the Board of Health. Thank you for leading today's discussion, Bridget. I'll turn it over to you.
Hi, thanks for having me. Full disclosure, I have 4 boys and they broke my headphones, so don't judge my duct tape too much. So as always, thank you, Lori. As we're all aware, the COVID-19 pandemic has impacted our daily lives from a multitude of perspectives. As different states began their different phases of closure and eventually reopening, one thing has stayed the same. Food service was deemed an essential function, and the industry has had to react to this fluid situation in a variety of ways. Our industry has been uniquely prepared to respond to many of the challenges due to compliance with the food code, which we all know is a set of scientific principles designed to reduce pathogenic transmission through food handling. I welcome the opportunity to share perspectives from 2 alumni as they adapted to the evolving CDC and regulatory standards from both the industry and regulatory perspectives. So I'd like Anthony, can you please take a moment to introduce yourself, your background, and what you do in your current role?
Yeah, sure thing. Can you hear me okay?
Yes, sir.
All right. Hey, so my name is Anthony Capozzoli, 06 alum for Johnson & Wales. I am the safety czar for Restaurant Associates, based out of New York City. My laser focus is on spearheading safety initiatives during and after the pandemic. I oversee our food sanitation and workplace safety programs, training, standard operating procedures. I chair the advisory board of industry experts to really guide our organization moving forward into this new food experience. I hate that term, new normal, because there's nothing normal about what's going on right now. So there's some great folks who work on our advisory board, from Beth Torin, the former executive director for the New York City Department of Health, Dr. David Buckley, who is the retail food safety director for Diversity, as well as a plethora of other folks. We really guide the organization with the facts and the information during this time based on the true data and the consumer sentiment. And prior to this role, I served as the Senior Director of Strategic Projects for Restaurant Associates, running all of our new business openings and renovations for our clients.
Excellent, thank you. Jackie?
Trying to unmute myself.
I hear you. You're all good, my friend.
Well, hi, everyone, and thanks, Johnson & Wales, for asking me to be part of this today. I graduated from Johnson & Wales in 2011 with my bachelor's in culinary nutrition. After graduation, I spent some time working for the Food and Nutrition Department at Rhode Island Hospital. For the last 7 years, I've been with the Rhode Island Department of Health, working as an environmental health specialist. So my primary role was inspecting restaurants. I work primarily in the retail food service side of the inspections. Since coronavirus has started, or this pandemic has begun, my roles has shifted quite a bit. Our main focus right now is obviously the COVID response. I'm currently assigned to the COVID triage team as well as a COVID task force. In this role, I'm helping, I'm working to help the public, keep the public safe, by helping industry understand and achieve compliance with the new regulations.
Excellent,
That's
thank
me
you.
in a nutshell.
Ha, thank you. I will say that Jackie was instrumental in doing some walkthroughs with us as we pivoted to our reopening plan a couple weeks ago. So thanks, Jackie.
No problem.
All right, so as we begin, we're gonna dive into some questions with our peers here. So Anthony, you first, if you don't mind. As you return to work, how did you make your employees feel safe?
Yeah, great question. Firstly, it was important to provide and mandate that back to the office training, that back to work training, not only regarding COVID-19, but also updated hospitality training, focusing on empathy during this pandemic. The updated PPE standards, or personal protective equipment standards, mandating mask usage and really highlighting the COVID-19 prevention measures. So that's the health and temperature screening, that's the contactless clock-in procedures, so folks don't need to punch in on a time clock. They could use their own mobile phones. Then the increased cleaning, sanitizing, and disinfecting measures. And definitely the disinfecting of highly touched surfaces, Bridget, that's been really important. Signage is a very important piece. The upfront signage and communications highlighting all of your COVID-19 specific initiatives is really essential. And guests are expecting it. I don't know about you, but I'm expecting it when I walk into a restaurant. What are you doing in the face of this pandemic? We also have an internal application called Nudge, and it allows associates to interact with one another. So they can see the latest happenings from the company, they can ask questions and really see some best practices. Lastly, you might notice this red vest behind me. We have these red vested ambassadors at each one of our locations. For our safety champions, we've called them for many years now. And these red vests jump out, and these folks are on the floor during service, and they're acting as the ambassadors and walking guests through that new food experience that I was just mentioning before. They're answering questions, and they even have these big yellow buttons, hopefully you can see this, that says, "I am trained," right? And it reminds folks that your safety really does remain their number one priority. And not only have we heard from the guests that that's been reassuring, but even our own employees have really thanked us for that.
Love it. Jackie, do you want me to repeat the question, or are you good?
I got it.
All right.
Mine's obviously from a different angle because I don't have any employees, but I'm working with industry to help business owners make their employees feel safe. So a lot of the new regulations that are out now and the guidance that we're requiring does just that. I know Anthony just touched on a little bit of it, but we're requiring such things as, work logs to identify who was working when. So, a lot of mom and pop restaurants, they don't even have punch, they don't punch in for their shift. They just kind of go off the honor system, like so-and-so usually works Monday through Friday, so that's what they're getting paid for. But now we're requiring that they write out who's working when, so that way in the event someone were to get ill, that will assist with contact tracing. Along with that, they also have to have an action plan on exactly what they would do in the event that someone was ill. That should touch upon if there's a need to close the restaurant for cleaning. I mean, that's not always required, but depending on the setup, if that needed to happen, how would they handle it? Other requirements are daily screenings of employees, which helps other employees feel safe, because obviously they want to make sure that the other people that they're working with are coming into work healthy, not having any symptoms. Some ways people are screening employees, some people are doing the temperature check at the door when their employees walk in, but we don't mandate that. They have to at minimum be self-screening and have been educated on how to do so. We're also requiring, not many, but all establishments are requiring masks. You have to practice, the physical distancing from each other as best as possible. Have to have the cleaning logs, like Anthony said, posting signage, informing, what's expected of customers as they come in, which will also make employees feel comfortable. If, a little bit is put on the public to be doing the right thing when they're walking in the door, that makes, employees feel a little bit more comfortable coming to work. So all these requirements and these plans, it just creates a really, a much safer work environment for these employees to be in, and makes them want to come to work every day.
Thank you. I just wanted to add as well that I live in Massachusetts and I'm the chairman of the Board of Health in one of the towns, but it's funny that we don't have requirements for signage for symptoms. It's not a requirement like it is in Rhode Island. So Rhode Island, before you even enter the facility, there's the picture with all the symptoms and little infographics. It's recommended, but it's not necessarily required. That specific signage. So again, as we navigate the different states, there are different sort of requirements, but I tend to prefer the Rhode Island standpoint. Anthony, do you have anything similar like that? Or are you guys doing that program wide?
Yeah,
customers?
You just hit the nail on the head. There's no cookie cutter approach to this, and each state and jurisdiction have their own little nuances. In New York City, there is a description of the symptoms that seem to be changing by the day. Just to mention,
you're right.
So it's important not to anchor to one specific thing, but yes, in New York City there are those specifications, and some other jurisdictions I saw the symptoms beyond the sign before entry.
Awesome.
Yeah.
I'm actually going to go out of order here because I think question number 3 relates better to question number 1. So forgive me. But pre-COVID, food safety and cleaning seem to follow the guise of public health. For example, when it's working, it's actually quite invisible. For example, deep cleaning often occurs at the end of the night out of a customer's line of sight. How has COVID shifted that perspective, and how have you been successful in relying your messaging of cleaning and disinfection to both your guests and your staff or facilities? Jackie, you want to go first this time?
Sure. So, when you said it used to be out of sight, I think a big difference now is that the public wants to see you cleaning. They don't want it to be out of sight. They want it to be obvious that you are cleaning at a high frequency. So that's definitely a big shift. One thing that we are asking for now that we never mandated before is some sort of cleaning log. So to go out, itemize exactly how you are thoroughly cleaning your restaurant every day. Also what the high touch surfaces are in your establishment and at what frequency you're cleaning them. So the feedback I've been getting, because that's the one thing that the actual logging that I feel like industry has been lacking a little bit, just because they know that they're cleaning, but they don't have any way to. They haven't, as of right now, had any actual log of it and be able to, when we walk in the door, say, here, this is my cleaning log. This is proof that I'm doing it. So when I bring up the log, their first response is, oh, well, we're already doing that, and we clean this and that, and all the high touch surfaces at every hour. So they have the plan in place, and I've just been, stressing the importance of write it down so it's no question. And then also that helps to keep your employees accountable, and also it makes, I think, the public feel a little bit more comfortable because they see it, they know it's there, it's no question. So, and once I, phrase it in that way, I've been getting really good feedback. I mean, people overall are like, oh yeah, that's easy. I mean, that's simple. I get what you're saying. So I think it's just been, like you said, it's something that we always did. It's just been a little bit hidden. Now it's kind of in the forefront, and we're paying a little bit more attention to it.
Yeah, Jackie just hit the nail on the head, and I'll speak quickly to one of the points that she just brought up, the cleaning log or the cleaning schedule. I think the main point you have to take into consideration is if you can't measure it, you can't manage it. So especially in these private restaurants, they need to note when the ice machine needs to be cleaned and when all those other pieces of equipment need to be cleaned. To answer your question that you just mentioned before with the shift in the perspective, Bridget, I think the answer to that question is that overt sanitation, right? It's one thing to say that you're up in your cleaning measures, then when a guest walks into your establishment and they don't notice it, right? So having more frequent cleaning and sanitizing being done throughout the food service period is necessary. And that's not going to change after the vaccine comes for this pandemic. The disinfecting of highly touched surfaces, your door handles, your chairs, your light switches, that's here to stay as well. It's been helpful for restaurant associates to have the red vested ambassadors because they're on the front lines interacting with the guests and the associates. And in some cases, they're actually performing the cleaning, sanitizing, and disinfecting. So that's been the differentiator for us.
Excellent. Great point. So with sort of that same vein of thought, how do you combat complacency from both sides of the coin, your employees and your customers? Because again, as being, my Johnson & Wales role here, we're constantly reminding our students and faculty about proper face coverings and frequent hand washing. But on my Board of Health role, I get a lot of complaints from customers. I don't want to wear a mask, or I don't have to wear it once I sit down. So why are you telling me I have to wear it when I walk through a restaurant? So there's like all this chatter. So for you both, how do you combat that complacency or that non-importance from your employee perspective as well as your customer perspective? Anthony, I'll go to you first this time.
Yeah, sure. So again, great question. And as folks get back to work and begin to feel more comfortable being around one another, there is a level of complacency that kicks in, right? Not only for the guests, but for the employees especially. And this is timely since yesterday you may have noticed a headline from ESPN with the Florida Marlins baseball team, right? And they were talking about that false sense of security. Here you had the team and the players where they ignored the protocols and ended up with the majority of the players testing positive for coronavirus. Had there been someone in charge of the enforcement, that may not have happened. So what you're seeing now from the MLB, NBA, soon to be NFL, are these COVID-19 compliance officers, right, or ambassadors. And I think rightfully so, they should be in place. These safety officers or these ambassadors ensure that people are doing the physical distancing. They're speaking with guests about the safety measures. And at the end of the day, folks need to know that they're safe while they're in your establishment. And you need to keep your staff safe from people who can potentially transmit the virus. So that's a little bit about enforcement and complacency for me.
Excellent. Thank you. Jackie?
Yeah, so I feel like I can only speak for Rhode Island, obviously, but our governor has obviously taken this extremely seriously, and she's taking some extreme measures to, make sure people are following the rules and that kind of thing. So that's why I have the job I have right now is, this task force that she put together. It's really, really, really hands-on. I mean, she hired a lot of people to just go out and do that just to make sure people are, complying. So, we are out there checking, we're on top of people. We also have a lot of, through this whole thing, they've had so many different press conferences. And as we all know, it's all over the news, it's all over social media. I mean, you can't go anywhere without hearing or thinking about coronavirus. So, we all know what the new rules are and what the regulations are. So I feel like the public is extremely hypersensitive. And when they go into establishment and they see somebody doing the wrong thing, they speak up. I mean, we're seeing a lot of complaints, even, so much as we're getting complaints about somebody going into an establishment and the customers aren't wearing a mask. People are calling us to say, hey, not even about the business, but the customers aren't wearing the mask. So I think a lot, just with all the knowledge that's out there, just with it being us being so consumed about it, that is combating complacency, in itself. The public itself, it's hard to get in their head and make them want to do what is recommended. And as far as what we're doing to promote it for, the public, that's why we require the signage. We're asking business owners, if someone walks in the door without a mask on, don't fight them, but mention it. Say, hey, do you happen to have a mask on to put, a mask to put on for me? So it's little things like that we're trying to, one, keep industry doing the right thing, but also keep, the public held accountable. Other things that are going on in Rhode Island, we actually have people that are going to places like, the beach that might have a snack bar or something like that. We're having them hand out masks. So there's a lot. I feel like there's a good amount being done in Rhode Island to keep industry in line and the public as well. but it can be difficult.
Oh, absolutely. I can totally relate to that. And
Yeah.
again, I'm a Massachusetts resident, and my husband's actually a local town manager, and he just got blasted, not personally, but his town all over the news because they had like a bunch of private house parties for graduations, and it increased their uptick by 1,000,000,000%. So now they're like one of the red towns where before that they had been, but it was all personal behavior. It was at a private
Yeah.
graduation party. It wasn't
Yeah.
at a restaurant. And everyone's so quick to say, well, I got it at this restaurant. No, you got it at your captain's practice for field hockey, or you got it at that graduation party, because there are no protocols in place at private parties, right? In industry, you're sort of uniquely trained to wash, rinse, sanitize. So now we're washing, rinsing, sanitizing, and disinfecting. So it's kind of a different lens for sure.
Absolutely.
So my next question is, how is the post-COVID world impacting your sustainable practices? Sorry, my phone's ringing. And what are the lessons learned in this landscape? So Anthony, if you could go first, does this impact your sustainability practices at all, kind of following up on the post-COVID?
Yeah, absolutely. The consumer sentiment right now is that the single-use cutlery and condiments, that they're safer. And that's why right now you're seeing a very big demand for wrapped cutlery, single-use condiments through the industry, right? Cafes and restaurants need them right now. It's important to note that there hasn't been one documented case of coronavirus transmitted through food or food packaging, according to the CDC or the FDA. However, the CDC is still maintaining its stance to discourage the shared objects. So despite the fact that coronavirus is inactivated at 133 degrees, right? So your kitchen dishwashing machine that gets up to 181 on the final rinse works just fine to deactivate the virus, right? And it makes it safe to eat on that silverware in China. And I think it's more right now, Bridget, a perception issue, right? The perceived safety versus the actual safety in the food science. As the general public, and as we were just mentioning, as the public starts to hear more about how person-to-person transmission is much more likely than surface-to-person transmission, I think they'll get back into the swing of things with more sustainable practices that you saw pre-COVID. More China, more reusable usage, as opposed to the single-use packaging that you're seeing right now.
It's funny that you say that, actually, because in Massachusetts, they just lifted the reusable bag ban. So now you can get your reusable bags. And grocery retailers are horrified or afraid of potential transmission. But it's not a vector, it's not a vehicle transmission. So if you bring your own bag, you have to bag your own grocery, which is what I like.
Well, listen, it wasn't too long ago that we were wiping down our Amazon packages and our food. Yeah, right before we brought it into our kitchen. So we've come a long way in the past few months with the information and the facts that we're getting. We just got to get through all that hysteria, and don't go to Facebook or Instagram for your knowledge, right? Research and get the facts right from the source, CDC, FDA, EPA.
Awesome, thank you. Jackie, what about as far as sustainability or reinforcement at the regulatory level?
I mean, I think Anthony hit a lot of the points on this one, but I thought about this a lot at the beginning, because I know, like, especially the last couple of years, there's been a really big push for, all industries to become more sustainable. And this just kind of seemed like at the beginning it was going to stop all of that. Everything we worked towards, getting reusable items rather than just everything disposable. This stopped it for a little while because people got scared, and I think a lot of it was the unknown. And there's still a fair amount of unknown. And I think that's why some people are scared. But as the days go on, day by day, we are learning more. And, like you said, there hasn't been any direct connection or proven like outbreak or anything, from someone eating off China. So I do think people are getting a little bit more comfortable, and this ties back to the cleaning and sanitizing. People want to make sure when they're going to your restaurant, the stuff they're eating off of is clean. So, I mean, I think we still have a little bit of ways to go to get back where, in the direction that we were going. But I think, every little thing that we can do to prove that restaurants are being as safe as they can, is gonna, help the public understand it. They're, like Anthony said, don't go to social media. They're gonna learn from the science and see what we're gonna lead by example. Industry is gonna lead by example, and they're gonna learn from us. And I think we'll get there. But yeah.
Slowly but surely. Right?
Yeah.
No, I think that's a great point. And I think too, in as much as sort of that perceived safety versus actual safety, right? And where's as a, an operator and of multiple restaurants and establishments, how do you balance perceived safety versus actual safety? How many things are you doing just because it looks good and it's going to get one more person in your door, as opposed to you have to do it because it's the right thing to do? Is that a weird sort of balance for you, Anthony?
Yeah, it's a delicate scale because, for example, I had just saw on top of the Florida Marlins piece that you just saw, you also saw in the NFL. I hate to bring up sports, but you had this organization, the Denver Broncos, and they were showing an image of their athletes walking through a misting tunnel, a disinfecting tunnel. And I don't know about you, but when was it actually safe to spray chemicals on people? And the science totally debunks that practice and tells you not to use that practice. Yet here you have this organization, multi-million-dollar organization that's doing it. So I think they're just doing it because of the hygiene theater, and that seems to be the word right now. That's the perceived safety, because the actual safety, let's face it, there isn't enough contact time for that disinfectant to sit on that surface for that little mist of spray that they're walking through. So it's a delicate balance. I'd much rather see more signage and more of the overt sanitation, more of the cleaning happening up front than some of these other practices that you're seeing that are thrown out there. It's like the wild, wild west with services and practices right now. So this is a delicate balance.
Well, even Bridget, you mentioned like the glove use, and that's one thing
we've had this conversation.
That's what I heard. I saw someone, I just have to mention this. I went for a walk one day and I saw someone running with gloves on. So like, it's definitely like some people had like a message that like, I don't know, like that was like a protection, and it really isn't. And we even get complaints that, like the public goes to an establishment and they see like a cashier, and we've had multiple complaints of, oh, well, the cashier wasn't wearing gloves. And we have to explain, they don't need to wear gloves. They need to wash their hands. That's, the biggest thing. So it's hard. You have that's exactly what it is. People perceive, glove use and other things as safe, but it might not necessarily be, so it's hard, but I think we're getting there. I really do. I think that as this is kind of, it's still scary. We're still seeing, a lot of cases, but I think that as more science comes out, things that people are able to think a little bit more logically and scientifically.
No, for sure. What gloves in general, are you getting more complaints, Jackie, other than just like front of cashier wearing gloves? Are you seeing in the beginning I definitely saw gloves everywhere, like you said, someone running, people walking their kids in carriages, there were gloves everywhere. People had gloves in their ears practically. Are you seeing that kind of come down a little bit now that we're sort of in like month 4, month 5?
Yeah.
All right, and then for both of you, one more sort of add on. What do you guys think about signage fatigue? Are you finding that to be real, or is that, because here at Johnson & Wales, we opened July 6th. We have signs everywhere. Don't worry, they're all blue and yellow. They're awesome. But, one of our signs is on the elevator, and it's, depending on capacity, some elevators are 2 to 3 people, and some of our small elevators are 1. And now that we're in week 4.5 or wherever we are in the summer session, I was walking the halls yesterday and I saw 4 kids get out of the elevator. And I was like, no. And they're like, oh my God, I totally forgot. I saw the sign, but I didn't even read it. And I was like,
yeah.
So what are your recommendations, Anthony being in the industry, and then Jackie, you kind of regulating this, how do we combat that sort of signage fatigue and that signage sort of checkout?
Yeah, that, again, another great question, Bridget. I think you can never over communicate when it comes to safety in the midst of a pandemic. However, you can over sign. And if you use too many signs, I'll just say very simply, things become hidden in plain sight. So that elevator rule might have been one more 8.5 by 11 on a huge board filled with papers, right? So you have to take that into account. You utilize digital signage, utilize placement is key. So it's certainly a thing. So don't over sign. Make your signs impactful, articulate your points well, and use digital signage or other means to communicate additional points. So, and also use SharePoints or repositories of information to revert people back to. And this way you can update that information as things change in real time.
Awesome. Jackie?
Yeah, I would say along with that, I mean, like you're kind of going towards like the technology realm and all the resources we have there, but also old-fashioned communication. You know, like make sure you're being, even with your employees, you have signs up everywhere, but once a week, have it in service and just go over it again. Because sometimes if you might hear something differently the second or third time you hear, it comes out. But also people need reminders, especially with so much going on. They need reminders. And none of this is normal for any of us. So we need to be, I've caught myself stepping out of the car and about to open the door to a restaurant. I'm like, oh, I got to go back to my car and put my mask on, so it happens. We're all human. So I think communication, and that's why, one thing along with the signs, we're asking industry to talk to customers. So if they do walk in the door and they don't have a mask on, kindly just say, hey, would you mind putting a mask on for me? And a lot of people, their first reaction is like, oh my God, I forgot. So I think communication is huge.
Yeah, it's a natural thing. And if I may, Jackie, you just hit on pre-services, and those pre-meal trainings are so key to get points across. And it's hard to break habits. Let's face it, you have folks returning to the workforce after a couple months off, they're reopening, you're not sure what to do. So those 5-minute training sessions, those reminders really go a long way. So you hit the nail on the head, Jackie.
I think it's great. Those are great points. And then again, for us, as we welcomed our campus community back, the first 2 weeks we were in session, our labs are 6:30 to 1:30 and then 2 to 9. And we send our leadership team to all the main doors, and we held the doors open and just directed the students kind of the flow that we wanted, just to help guide them and remind them, and then just sort of course correct as we go. And we still do it every day, not all 15 of us, but we're still kind of going around and just reminding and being a visible resource. And I think that visible resource, like your red vests and your inspection protocol, Jackie, are super important. So thank you both. Now we're going to move into the debunking the myths section. So we wanted to kind of throw out some questions to all of our attendees and figure out sort of what's COVID true and COVID false, with Anthony and Jackie's help in answering. So our first question: if a line cook has tested positive for COVID, does that mean I will get COVID from consuming food that they have prepared?
I was going to vote, but the hosts and panelists.
I know, we're like in timeout. No vote for you. I don't know where it goes. Okay, now it's gone. Okay. Oh, fall. Yay, look at that. Excellent. It's funny that I'm glad, because that's still been something that I hear both from students, faculty, and locally at the Board of Health. All right, our next question is, I don't know where it is. Guys, technology is not my thing, if you couldn't tell. All right, facial coverings are always required in restaurants. True or false? Ooh, we've got a 50-50. All right.
It's like right down the middle.
I know. So facial coverings are always required in restaurants when, Jackie?
So anytime you are not actively consuming food in Rhode Island or drink, you should have your facial covering on.
All right, Anthony?
Yeah, and you're seeing more and more jurisdictions besides Rhode Island pick up that law, because let's face it, the person-to-person spread is still believed to be the #1 way to transmit the virus. And if folks are properly wearing masks, we're told that's the best prevention strategy, along with the physical distancing.
So, and I think it's important to note too that as an owner-operator, you can stipulate that masks or facial coverings are required, even if your local municipality has not required that as such. So just kind of keep that in mind as well. All right, our next question is, I'm not feeling sick, so I can't have COVID. True or false? Excellent. So we do know that there are quite a few asymptomatic carriers. That's probably the onus of half of the school driving decisions right now, because kids can have COVID and not really have symptoms. So excellent. Our next question is, restaurants are taking my personal information for contact tracing. True or false? All right. Anthony, are you guys taking personal information for contact tracing at your establishment?
Yeah, well, we're taking information, name, phone number, email, and holding it on file in the event that someone tests positive and they need to contact you.
Perfect. And then Jackie, in Rhode Island, up until fairly recently, reservations were required, right, to allow for this particular contact tracing mechanism. And now you
Yep.
can kind of still, you can dine in now, but you have to provide your name and phone number, correct?
Correct. Yeah. When we first started opening dining, it was reservations only. They did quickly allow people to walk up, but they are supposed to be, they are required to be taking, anybody that sits in a restaurant to dine or drink needs to, they need to take the customer's name and phone number for contact tracing.
And again, that can vary by state or municipality depending on where your restaurant is operating. But again, if you are the owner operator, you can mandate that out of an abundance of caution. So just keep that in mind.
And Bridget, you're seeing folks gather that information during the temperature and health screening process. Yep. So during that process, they're asking those questions. So it's already there. It's not as if, hey, before you dine, please fill out this form. Before you get in the door, you're answering those questions and submitting your information. And I think people overall, from my belief, they've been really accepting that, and they want to know. I don't know about you. I certainly want to know if I came into contact with someone that was positive.
Yeah, I definitely think as time has passed, that has been the new trend. I think that when we first started here on campus and required all of our students to download the Crush COVID app, they felt like it was a little bit of a violation of their privacy, but we had town halls and we continued to talk to them about why we needed them to have that information and what it would be used for. And the tone definitely changed. So education is so important as to why you're collecting this data. Not to call you next week to give another reservation, but in the event of something, we'll contact you. Yeah. So the next question is, if I am contacted by a contact tracing specialist, it means that I have COVID. True or false? Well, I didn't see the answer. Thank you. Perfect. Yes. So contact tracing is really just to help identify who else you may have been in contact with, and through that informal interview, they'll help determine whether you are a true with contact within 6 feet for 15 minutes with no facial covering, and they'll help get you tested if you need to be tested. But it does not always mean that you do have COVID. We do encourage that if you ever get a call from the contact tracing specialist, that you do answer the phone and work with that person. Our next question is that contact time for disinfectant is just a recommendation. True or false? Excellent. This makes me very, very happy. Because again, I think that my big concern as we started to transition to reopening is that restaurant industry is so fast paced. And contact time for disinfectant is obviously a lot higher than a contact time for sanitizer. So Anthony, what are you guys using for a disinfectant?
Yeah, we use Diversity's Virex 256 product. And for that disinfectant, it calls for a 10-minute wet surface contact time. And I did even see a question. There are some chemical sanitizers that have actually been known to deactivate the coronavirus with a long enough contact time. So really reach out to your provider, and each single chemical will have a different surface contact time.
So what are you doing for your, as you're doing like table turns to make sure you have that 10-minute contact time? How are your employees observing that 10 minutes? Are you guys doing anything kind of innovative? Are you using a timer? What's happening there?
Yeah, great question. In some cases, we're only flipping over a seating area once or twice. So we've even come up with a simple solution for a little button that sits on a table that says, "I'm clean, please sit down," or "This table hasn't been cleaned and disinfected yet." So that's just an example of something that's being rolled out here in New York City. Besides the essential workforce, seating areas are still very much closed, and indoor dining is still very much closed. So I'm sure there's more things that will come up in the future.
Jackie, have you seen anything innovative as far as observing the contact time and turning tables around? Because I'd love to see people just spray everything and then wipe it real quick and then sit people down.
Right. Yeah. So so that happens. But we've also seen things like Anthony said, like little signs or buttons or something that you know, they keep it as closed or, you know, not clean or do not sit or something like that. And then, you know, after the time has passed, they would flip it at that point. I mean, it's definitely something that's a little bit, it's hard, but right now, unfortunately, numbers are still, people dining out, it's still kind of low. So I think the majority of restaurants can handle, you know, the time it takes, but, you know, on a Friday, Saturday night, that might be a different story.
And if I may, what you are seeing a lot of, and I think another false sense of security, are the electrostatic sprayers. So you have many locations and private restaurants that I've personally seen folks using it incorrectly. There's no doubt that it's efficacious in deactivating the virus if there's enough surface contact time, but just simply spraying a surface and moving along certainly won't deactivate the virus. So I think that electrostatic sprayer, you really need to research the contact time and that unit for the folks that are on the line that have that.
Yeah, I think you said research is the main key. Any product that you know, there's so many different products out there now. You know, you really gotta, like you said, ask your purveyor, do some research, and make sure you're using it correctly.
I think that's excellent. What we're doing here in our small little operation is we bought egg timers that are longer in minutes. Yeah, and we flip them over and then the table is but something, you know, and that way it's visual, right? Because at the end of the day, yes, we're serving food, but we're still a learning institution. So getting the students to see these different types of, you know, alternatives is really important as they prepare to enter the workforce as well. So our next question is statement, true or false, is hand sanitizer is just as effective as hand washing. True or false? Ooh, true or false? Hand sanitizer. All right, Jackie, Anthony, what do you guys have to say about that?
I'm actually surprised it's not more of a 50-50 split here, to be honest with you. Hand washing, in my opinion, is still best. However, if you're not at a location where you have access to a restroom or a hand sink, the CDC has even came out and said use a gel-based hand sanitizer with at least 70% alcohol. That'll be effective in deactivating the virus, but you should always lean towards washing your hands.
So yeah, I'm surprised there's not more of a split actually, but that makes me happy because in my opinion, hand sanitizer doesn't replace hand washing. I mean, like you said, if you're out and about and you need to use hand sanitizer, does it work? Yes. Is it effective? Yes. But if you're in a kitchen, you don't want to use hand sanitizer rather than washing your hands. You know, you want to be washing your hands. So, you know, when your hands are soiled, you go to the sink. You don't just say, oh, yep, I squirted some hand sanitizer on it and I still got like, you know, chunks of meat on there. But so in the kitchen, wash your hands. Absolutely. And like Anthony said, if you're out and about and you can't find a sink, absolutely use hand sanitizer.
Yep, I liken it to, as I talk to people here, you know, yes, we're COVID conscious, but COVID is not the only pathogen or virus we're protecting against in the kitchen, right? So we still want to be washing our hands as required. And again, when we have that weird instance where we can't wash our hands or we're just coming into our car, getting out of our car, yeah, hand sanitizer is fine, but I would always advocate for the hand washing. And actually right before my boys got out of school for the closure, the first week the last week they were in school, they had to wash their hands and then use hand sanitizer every like 45 minutes. And my littlest was like, my mom doesn't like hand sanitizer. Don't make me. So they probably thought I was some sort of a wingnut, but whatever. All right. Next question is, wait staff should always wear gloves. True or false? Perfect. So again, keep in mind that you may have an additional requirement to wear gloves depending on your jurisdiction, but if wait staff are not coming into contact with anything, dirty gloves are worse than dirty hands. But a facility may have made that part of their reopening plan, so it could be contingent upon that, but I would much rather see clean hands than sad gloves any day.
Agreed.
Anthony?
Yeah, agreed. I'd much rather see folks continually wash their hands as opposed to having that false sense of security and cross-contaminating everything with a pair of gloves on. Waiters specifically should be dedicated to taking orders when possible with minimal guest interaction, and runners should be solely responsible for running food. And you should work those standard operating procedures out prior to your reopening. I see some of the questions that are working through, but yeah. Hand washing.
Jackie, good?
Yeah, hand washing.
All right.
Wash your hands.
So our next statement is, restaurants should always screen guests and employees by taking their temperature. True or false? True. False. All right, so I'm going to kick this back to Anthony first. Anthony, statement here. So 78% of the people think that they should always screen guests and employees by taking temperatures. What are your thoughts here?
Yeah, I think so. You have to, there's no cookie cutter approach. You have to certainly weigh in the thoughts of your local jurisdiction. I think it's personally a best practice. At Restaurant Associates, it is a requirement for all employees and all guests entering into the facility. I think it's pointless if you screen one set of people and not another set of people, especially when they're both interacting with one another.
Okay. Jackie, anything to add there?
So, I mean, as far as requirement, in our state, it's not a requirement. We do say you have to screen everybody that enters the building, but the term screening is a little vague. I mean, you don't have to use a thermometer, but you could go through a series of questions. I mean, it's hard because obviously, yeah, it'd be great if, you know, every establishment had a working thermometer, but there's also issues with thermometers. A lot of times they might not be reading the correct temperature. So I think a huge thing is just educating the public on when it's appropriate to stay home. So I think that's what the push is in Rhode Island, is you're screening them in some way. You're making sure to ask those questions. Have they been exposed? Do they have any of these symptoms? And by doing that, you're really educating them, you know, so you don't have that, you know, the other thing too is if you take their temperature, they might not have a temperature, but that doesn't mean they weren't, you know, sick in the bathroom last night or have a severe headache. So especially with this virus, there's many other symptoms. So the only symptom isn't a fever. So we need to make sure we're screening for all symptoms.
How do you think the COVID screening plays into the employee illness reporting agreement and that type of practice that your employees are already following based on the food code?
I think this has made people realize the importance of, you know, an employee illness policy and employee illness screening, because, you know, before it was just, you know, yeah, people get sick. Now it's a pandemic where it's like people are getting sick and rapidly spreading it, and that could happen in your establishment. So I think, you know, if people are seeing the importance of it, I think this is, as unfortunate as it is, I think in the long run, this is going to help us, you know, hopefully, you know, lower different illnesses, something like norovirus, which was, you know, one of the highest foodborne illnesses. You know, if people take this seriously and learn, you know, when you can go to work, when you can't go to work, I think in long term, this is going to be beneficial.
Yeah, I agree. hospitality has been an industry where in the past, folks may have glorified the fact of, hey, I'm working through being sick, or I just did a double and I don't feel good, but I'm going back in. So now the pandemic has shined a light on not only your associate health policies, but really taking personal hygiene and having to step it up. So I think out of bad now comes good, and we need to have tough conversations and follow up. So not only are we not bringing COVID-19 in the door, but norovirus and Hep A are still there. They're always there. So that associate health policy needs to continue to be front and center.
Excellent. Thank you. I couldn't agree more. So our last little true or false is all restaurants are following the same protocols. True or false? Excellent. And honestly, from my perspective, I think that is actually kind of an inherent challenge, is that there is not a lot of consistency from municipality to municipality or state to state or even federal. So we're sort of left sort of filling in these gaps and trying to figure out what science and protocols work best within your operation. Obviously, if you're working in food service in a nursing home, you're going to have different protocols and procedures than if you're working, you know, at a Dunkin' Donuts in Massachusetts where we have 7,311 of them. So it's going to vary. Anthony, you first, and then Jackie.
Can you repeat the question one more time? Sorry.
Just the fact that all restaurants are not following the same protocols. How is that a challenge for you?
Well, there's no cookie cutter approach to it, and each state has their own nuances, and everyone's adding on their specific twist to it. So it's difficult. Fortunately for restaurant associates, is that we do operate throughout the United States, and we do have a set protocol in place. So we follow the FDA food code, and then we have a set of workplace safety practices that we follow and share, and that's been our good fortune. But it's very difficult because Jackie in the state of Rhode Island is enforcing one set of laws, and then look at you in Massachusetts, not too far away, you may have a complete different set of rules. So talk about confusion, especially for those guests that travel and experience both of those different experiences.
Yeah, I agree. I just, you know, I think that's the hope for everybody, though. They wish that as, you know, a nation, we would just kind of get on the same page. I mean, especially somewhere like New England, where we're hopping state lines every day. I mean, you know, yeah, it's not unheard of, especially Rhode Island being so small. There's so many people that, you know, travel to Massachusetts or Connecticut for work. So, you know, if overall we were all on the same page, I do think we would do a better job at, you know, slowing this virus down and you know, making a change for the better. So it's tough. It's tough.
Awesome. Well, thank you both. At this time, I'm going to turn it over to Liza. Liza.
Thanks, Bridget. So we have a little bit of time for some questions from the audience. So if you have a question for the panelists, please add it to the Q&A section, and I will refer to that to ask the questions. So the first one is, if one of your kitchen associates tests positive, should we close all food sections, cafeteria and other food related departments?
Yeah.
So I would say, I'll jump in and then you can answer what you guys are doing specifically. So in Rhode Island, it's not necessarily required that you close. You obviously have to go through the motions of the contact tracing, and it depends on your setup. Some places might have to close. Some places might be a situation where all employees were exposed to this one sick person, and so they don't have anybody else to work, so they got to close. You do have to do some sort of thorough cleaning and investigation on when that person was working and that kind of thing. But is it required that you find out someone's sick and you just close the doors? No, not necessarily.
Yeah, that's exactly what I was going to mention. It's not necessarily a stipulation by these jurisdictions. In some cases, we talked about the disinfectant usage before. It's only 10 minutes of wet surface contact time to properly deactivate the virus. So really lean on your jurisdiction and your local Department of Health to give you that guidance. I think what we're seeing throughout the country is about 24 hours is the general rule of thumb where establishments will ask to be shut down, and that just gives you a little bit of time to inform the staff and begin that contact tracing element.
Yeah, and just to add to that, you know, you had a good point. Like when somebody is confirmed positive, obviously their name goes to the Department of Health, and then, you know, they're asked a series of questions, one of them being, where do they work? So once the Department of Health has that information, they do reach out to all their contacts, and it's not, you know, it's most likely that they're going to reach out to their employer to, you know, go over what needs to be done, you know, depending on their situation.
And then just also keep in mind that it depends on the level of publicity. So if your establishment has been publicly outed for having a coronavirus positive and the public doesn't think you shut down properly, you will get some feedback from them as well. So just kind of figure out the market that you're in the audience in that area. So in Massachusetts, we just had 2 restaurants voluntarily close because they had 2 different they shared staff in 2 different locations in the same town, and they were out of an abundance of caution. And I think them closing out of an abundance of caution and making that information public actually won them more public support than if they had stayed open. So it's that weird, again, perception versus reality, science-based thing, but that's the reality right now for all of us in the food industry.
Our next question is from Sherry. She is in San Diego and says that there they've gone to outdoor dining and streets have shut down so people can dine. Do you think this is a viable solution to help restaurants survive?
Absolutely. Al fresco dining has worked tremendously well here in New York City. We're in phase 4 right now. We're waiting on indoor dining, but there's nothing better than fresh air, the circulation of air, especially when you're seeing, Liza, you're seeing more and more on the droplets and the airborne nature of the virus. So al fresco dining is certainly here to stay, and I think you're gonna see more street closures to allow restaurants to get back to work. And let's face it, if that's the key to getting the restaurants open and getting guests in the door in the first place, then we should all get behind it.
I would agree 100,000,000%. In Massachusetts, there has been a push. The ABC, the Alcohol Beverage Commission, actually lifted some of their strict regulations to allow for that to happen. But we are seeing an increase in rodent activity in those outdoor dining areas. So again, we want to control for the COVID risks, but you never want to forget about all of your other food establishment risks, and making sure that if you do outdoor dining, if you have a platform, that you're power washing underneath that platform once a week, you know, whatever you need to do to mitigate those other risks as well. So just kind of be mindful of that. But I think it's a great idea. I go often. Jackie? Anything?
Yeah, I completely agree. I mean, I think people stayed home for so long that, you know, obviously the industry was suffering. So anything that can be done to get people out, and I think people will just feel more comfortable being outside. So it'll get people out and spending money, and I think it will help industry.
And Liza, one thing to add, while al fresco dining is really a great way for to make the way for next steps, enforcement really should be taken seriously, because then, as Bridget was just talking about, you don't want to be outed and you don't want to be on the media, on the wrong side of the media for violating physical distancing measures. So if you do offer outdoor dining, have the floor signage, have the physical distancing markers, have clear signage that you must wear your mask until you're seated and you're actually consuming food, like Jackie mentioned.
We have a question from Matthew. How does a food service employee best respond to a guest who decides not to wear a mask for political reasons?
That's a hard question. I mean, we can tell people, obviously, don't fight anybody. I mean, you can't get in a fight over this stuff. But I mean, as best you can, just say, hey, can you please put a mask on for me? If it turns into a fight, I mean, you gotta walk away, obviously. But I think, yes, we hear about those stories, but I think the majority of people are on board, I would have to say, especially, well, at least where we are. I can't speak for other states at all. You know, every state's very different. But here, I think the majority of people are on board, and a lot of times it's just, you know, if I forgot kind of thing, or people will wear it even though they don't want to. But just do what you can, post the signs, simple, kind reminder. If it turns into a heated discussion, I mean, you got to leave it alone at some point.
Yeah, you're going to deal with difficult people, and let's face it, this is a very big argument right now in the United States, and there's a lot of information on both sides, so you have to be empathetic. However, you have to be adamant that in order to eat in this establishment, you must wear a mask. And in states where it's a state law, that's the requirement. So if it was me, I would certainly offer to give them a mask, so this way you can accommodate them and give them their food. If they do decline, then escalate it to your manager or ask them to leave the premises.
We have a couple questions about sanitizers and disinfectants, so I'm going to lump those into one. So what has the scientific evidence shown about common kitchen sanitizers' ability to kill the COVID virus? And also, what type of disinfectant would you recommend to a mom and pop type of restaurant?
Yeah, so I had just mentioned this before. Some of these sanitizers actually are effective in deactivating the virus, and a lot of the distributors and manufacturers will note a wet contact time that the product needs to sit on a surface in order for it to be efficacious. So I would tell that person to, number one, reach out to your sanitation provider, whoever your chemical company is. So that's the first. And what was the second question again?
About household disinfectant. What is the science shown about common kitchen sanitizers?
Yeah, I know Bridget and Jackie can speak to this too, but the CDC as well as the FDA has put out a thorough list of household, even disinfectants that you can purchase over the counter or in your local grocery store that works just fine. So go ahead and check out that list. Otherwise, reach out to your chemical provider for assistance, whether it's Ecolab, Diversey, or such.
There's an EPA link and a CDC link for approved COVID-19 sanitizers and disinfectants. So Liza, I'll get it to you because I'm working off 2 computers. I can't pull it up. And you can share it with all the attendees. There's two lists, and it gives household products as well. And that's what we're looking for as we do, approval and reopening. The only other caution I would have is that if you're investigating using a new chemical, reach out to your provider as well and make sure that it's not going to react with any other chemical you currently have online. So you never want to bring in a chemical that may have an adverse reaction with some of your other chemicals, causing a noxious gas or plume that could make your employees or customers ill. So it's really important that you reach out to your provider and get all that information up front. And as far as the mom and pop question, they'll be able to find the information right on the CDC EPA report. I'll get that over to you.
Thank you. We'll provide that to everyone.
You got it.
We have a question from Sarah. What are your thoughts on self-serve soda fountains? I've heard different opinions on if these should be able to remain open or not.
Yeah,
Okay.
I think.
Go ahead.
Yeah, I think as you're hearing more and more, the surface to person transmission is not as likely. I think we talked about the perceived safety versus the actual safety. My first recommendation would be to go back to your jurisdiction and see if it's even allowed. There's some jurisdictions where salad bars are still very much allowed. So go back, ask your jurisdiction if it's allowed. And a self-serve coffee station, I think the science will back up the fact that it's okay during this time. However, you have to depend on the jurisdiction to give you guidance.
Yeah, so we had in Rhode Island, we did have them closed for a while, but we few weeks back recently allowed self-service drink stations. Like you said, the science is showing that combined with also what we're requiring industry to do, it's it's safe. It's relatively safe. You're already screening people at the door when they come in, so hopefully people aren't coming in sick. You're already sanitizing and disinfecting surfaces at a higher frequency. And then, just think of the nature of it. You're grabbing a clean cup, you're putting a clean cup, usually it's, a push dispenser, or even if it's a push button, they're coming around quite often to clean it. So as of right now, it seems that it's relatively safe.
And they have the contactless dispensers too. It's like,
right, it's true. Yeah.
Every company is coming out with contactless dispensers. I especially love the paper towel rolls in the restrooms now. I mean, I don't know about you, but I hate those Seafold towel dispensers where you grab about 35 Seafold towels and wash your hands. So the contactless dispensers are certainly popping up, and I think it's a great thing.
I just
Yep.
caution you all who are on the call to keep in mind that it's been my understanding on my CFP, on my Conference of Food Protection calls, and some of my other statewide calls, both in Rhode Island and Massachusetts and Connecticut, wherever, is that it's not necessarily equipment that they're worried about. It's the fact that people congregate and cluster
Right.
at the machines. So if you're going to go ahead and say, yes, I'm going to open my soda machine, you have to have that signage. You have to have your magic little markers on the floor, and you have to have sort of a physical distancing, steward or, ambassador to make
staff
sure that
monitoring.
that is being monitored. So, because again, if you have the best written protocols in place for cleaning, disinfecting, sanitizing, whatever, and then you got 94 kids shoving their cups under whatever dispenser, it's all for naught. So I think
Right.
and that's
totally
part
true.
of the challenge with like buffets and things like that. It's not that they're necessarily worried about food as a transmission source, or even really the utensil sometimes. It's that food is social. Everyone kind of clusters together. They want to hang out and be tight in the salad bar and throw whatever on their plate. And it's more that close contact for that period of time that is the risk. All right, sorry, I'll stop talking.
Oh, it's great. So one question from Laurie: if you wear a face shield only as a server, should you also have on a mask?
Yes.
Absolutely.
Yep.
Yeah.
There's a lot of reports coming out even as early as yesterday that face shields are not an exemption or an exception to the facial covering. It provides additional protection for your eyes, but it does not prevent the droplets from coming down. So yes, you still have to wear your
mask.
And then we have time for one more question. So if you had a question here and we didn't get a chance to answer it, we'll try to follow up with you with responses. So the last question is from Wendy. She is a chef at a school in Florida that is reopening soon. And they are moving to simple boxed lunches and pre-made salads. They're trying to get as many green-friendly disposables as possible, but do you have any other recommendations for a school cafeteria environment?
What about bento boxes? So my company, Catering by Restaurant Associates, is doing fantastic work with breakfast, lunch, and even dinner bento boxes, and some of which are eco-friendly. So I would ask you to go back to your provider and see what other alternatives. Think, and how about this, no pun intended, think outside the box as well. What other options are there for you to put both perishable food and grocery and beverage products in? So you utilize different things.
And there are bento boxes that are reusable. We are still kind of researching them here, but Virginia Tech has some systems, A&M, UNH, and what they do is you get a clean, actually, who's here? Not URI, PC has a similar system as well, is that you get your container, you eat out of it, you put it inside of a different receptacle, and then it will get collected, washed, and sanitized at above 180 degrees, and then kind of reused. So you can actually reuse and repurpose those bento boxes or reusable containers. I actually have a call at 4:30, Wendy, with someone about that type of stuff. So I will get your contact information from Liza, and I'll connect you with the person I'm going to speak to at 4:30, if that's okay.
I also think that if you're going to go with disposable, you should also consider some tamper-proof packaging, and talk about a psychological subtlety, but that perceived safety of having a tamper-proof piece of tape on there to know, hey, after the food handler got done with it, no one handled your food, goes a long way. And that might be a hit where you're specifically at, Wendy. So check out a tamper-proof packaging, and you can certainly research more of the eco-friendly options if you're not in the market for reusable.
Great, well, thank you. We're just about out of time, so thank you so much, Bridget and our panelists, for such an informative and interesting discussion about what's being done to protect consumers and staff in restaurants. We're so grateful to you all for sharing your time with us today and appreciate your insight on this topic. In such an unprecedented time, it's impressive to hear how you've all been working to chart your course for the future. We'd also like to thank all of our alumni attendees for joining us today. Food safety is just one of the many things our students learn about in JWU's new College of Food Innovation and Technology, or CFIT. CFIT is a landmark interdisciplinary approach to education meaning we work across areas of expertise to develop creative methods of problem solving. You can help support tomorrow's food and beverage leaders today with a donation directly to the College of Food Innovation and Technology. If you're in a position to give back, your gift will be put to use immediately as we embark on a new era at JWU. I've shared a donation link in the chat window, and on behalf of our students, I thank you for your generosity. I sincerely hope that you all enjoyed today's session, Fact versus Fiction, JWU Alumni Protecting Public Health and Preserving the Restaurant Experience, part of the JWU Connects family of programming. Through JWU Connects, alumni can engage in informative and interesting discussions related to professional development topics, as well as opportunities for networking and connection with fellow classmates and faculty. For the full listing of upcoming events, including tomorrow night's Cook with JWU on Instagram Live, please visit our events calendar at alumni.jwu.edu. We appreciate your attendance and wish you a wonderful rest of your day.
Thanks, everyone.
Thanks, everyone.